Hello, it's Dr. Beth Colby, psychiatrist from London, on YouTube channel Talk Mental Health. There's a lot to be anxious in these unprecedented times. It seems as though every answer to a child's question is coronavirus or COVID-19. Why can't we visit grandma in her nursing home? Why can't we take you out to the pub for Mother's Day? Why is Daddy working from home? Why can't I go to school? Why are people wearing masks? Why do I have to wash my hands all the time? Why can't I have a play date? I'm sure you could tell me lots of other questions that people are asking at this time, grown-ups as well as children. In January 2020, the World Health Organization called the COVID-19 pandemic a public health emergency. To me, it seems as though it's not just a physical health emergency, but a mental health one as well. People have responded with fear, anxiety, worry and stress. Anxiety is a normal response to a threatening stimulus, and it's designed to keep us safe. It gets us ready for the fight and flight response and gets us prepared for action. However, the threat of danger is uncertain. The rules keep changing, and different countries' rules are different to ours, as they're at different stages in the disease. People are becoming subject to a prolonged state of threat. New words and phrases have sprung up. COVID, self-isolation, social distancing. New human behaviours have developed. Fights over toilet rolls, taking all the pasta off the shelves, wearing masks, sending funny videos of toilet rolls and hygiene measures. Some people are ignoring bans on pubs and social gatherings as if they're denying the disease or thinking they're invincible, and that's not protecting other people. Elbow bumps and ankle shakes. As well as anxieties of the disease itself, people may have anxieties about their jobs, money, paying the rent, medication, food. COVID-19 has caused a mental health emergency. How can we keep ourselves sane and mentally healthy in unsane times? Well, we know that physical and mental health are interlinked, and exercise is mental health, as Joe Wicks said in his Body Coach video for children this morning. It's important that we eat healthily, regularly. You know that tinned fruit and vegetables and frozen fruit and vegetables are as healthy as fresh ones. Keep yourself hydrated, but not with alcohol, please. Do regular exercise. You could do that inside, as well as if you're keeping a safe distance, walking in your neighbourhood or in the woods or the park. But remember, 2 metres away is what they're saying. Have regular rest time, get fresh air, have good sleep pattern. The other hygiene measures, as well as social distancing, hand washing regularly for 20 seconds or more, greeting people with the ankle kick and elbow bumps, coughing and sneezing into your elbow or into a tissue and then putting it in the bin. Being careful about the environment, touching things. We used to say, and maybe some people do, that we're too busy, we don't have enough time for anything. And now it seems as though we've got too much time. Our lives are on hold, or some people feel as though their lives have stopped. Try and maintain as normal a routine as you can to maintain some form of normality. If you're working from home, try not to blur your work and rest boundaries. Set yourself breaks, diarise things you need to do, have regular short walks in the fresh air. Even consider wearing work clothes and then change out of them when you've finished. It's very important for children to have a regular routine, bedtime, meal times, going to their home school at the normal times and having break times when they normally do. That's good for the parents' mental health as well. Think about how you can use this time if you've got too much time on your hands. Think what new projects you might want to do, what you might want to do in the house or garden. Put photographs in albums if you're of that age. Restrict yourself to exposure to fake news or overwhelming, distressing information. Get your news from trusted sources such as the World Health Organization, Department of Health or NHS. And of course, stimulate your mind with reading, crosswords, Sudoku, learning a foreign language. What about behaviour? Don't make important decisions while everything's uncertain. People tend to make bad decisions when they're under stress. It's important to feel in control and have the facts and act to keep ourselves and others safe, because then people feel empowered and less anxious. Think of others. Be kind, patient to other human beings. Be supportive. One good thing about this epidemic is that communities are coming together. People are getting to know their neighbours and supporting them. Do things to take your mind off your anxieties. And as Boris said, stay home, protect the NHS, save lives. Take time to smell the roses, literally if you can. Do what you can to remain calm, like listening to music, reading, watching something relaxing on television, whatever you find relaxes you, apart from alcohol, of course. Don't spend too much time on electronics or on social media, because that can exacerbate a sense of panic and worry, unless it's being supportive and positive. It's very difficult for people who live on their own and are self-isolating, because humans are social beings. It's not natural and good for our mental health to be on our own or in solitary confinement, which is a punishment. So make sure that you keep in touch with people who are on their own and self-isolating. People who are self-isolating, try and keep in touch with your nearest and dearest by phone or social media or FaceTime. Hugs and handshakes are part of our basic core social interactions, and we're not meant to be doing that now to help prevent the spread of coronavirus. So that's hard on everybody. It's important to have a support network around you, especially people in your inner circle and close family, not just social acquaintances. Diarise things you want to do, things you can look forward to, even if they're not going out to the cinema or pubs and clubs and everything else or gyms, everything else that we used to be able to do. These are strange times. I think everyone agrees that. The people who are most at risk of decreased mental well-being is people who already have a pre-existing mental health condition. So for you guys, take extra care and get support where you need it. If you've got OCD, please don't wash your hands more than you normally would anyway, if that's one of your compulsions. I'll end by a quote said 2,000 years ago. Do to others what you would want them to do to you, for this sums up the law and the prophets. Okay, we're in this together. Be patient, be kind, keep well. Spread kindness, not coronavirus. Thank you for listening.